Welcome back. The vaccination drive in South Africa is in full swing. To expand coverage, the SABC, in conjunction with the Health Department in Gauteng, has launched a pop-up vaccination site. Let's find out a bit more. We're joined by the SABC's GE for Marketing and Communications. That's Gugu Ntuli. Ms. Ntuli, thank you for being with us. Tell us about this pop-up. I understand all the action kicks off tomorrow.
Absolutely, Francis. Good afternoon to the viewers. Yes, we are quite excited about this initiative. The SABC has partnered with the Gauteng Department of Health, and we're working very closely with other organs of state for this pop-up, the pop-up site, which will be based at the Auckland Park campus and be catering primarily to the communities in and around Auckland Park, particularly the universities that are close by, but also our commuters, because we are actually on the public transport route, which makes it easy for the public to access us.
All right, so not only for SABC staff members, do they get any preference in the line at all?
Well, they are the public as well as staff. So I think what's good for all of us as staff is that, you know, we have a facility accessible right there on our doorstep that we no longer have to queue up for, and it can be done fairly quickly, and off you go, you've got your jab.
Yeah. Why did it take so long? I mean, I understand this is now a bigger thing, but there have been calls for a very long time for journalists. Right from the beginning, they were out on the front lines, as it were, sometimes in danger, calls for journalists to be vaccinated, the young journalists. So now SABC is on board, but that's after all the sites were open for 18 to 34-year-olds, and a lot of people who wanted to be vaccinated have already gone.
Well, you know, Francis, it's important to highlight that the SABC didn't need to wait for a vaccine site to be proactive about ensuring that its staff members have access. So staff members have been prioritized. We've got a very strong wellness program within the organization that has constantly given information about where to go, how to access.
Yeah, but they haven't been giving vaccines, right?
No. Absolutely. Staff have had access to vaccines, and the medical aid for SABC staff has continually provided information to staff members to register, to go and get their jabs, etc. So I think that has been happening internally. However, we saw an opportunity as the public broadcaster to not only then facilitate such a facility for our own staff members, but also to consider the communities around us, particularly because the young people are now a focus for the government rollout.
All right, and this is potentially big because it covers Wits, Rao close by as well, so a site for those students. How big is it? How many people can get vaccinated at any particular time? Because we're talking about a pop-up, not a permanent facility.
Look, I mean, the government's numbers are quite ambitious, and I cannot speak on their behalf, but of course, they really do want to they want the SABC to assist them in driving the message, the importance of being vaccinated, not only, I think, for the health of our people, but also just to ensure that things get back to normal as quickly as possible, as you know, and it has been a devastating period for the country. The unemployment stats were issued just yesterday, and they are really dire. And of course, the youth are most affected by all of these. So it really is incumbent upon us as the SABC to assist in getting the key messaging out there, ensuring that the public is aware that there's a site at the SABC that they can access. I mean, between those 4 or 5 institutions, I mean, we've got AFDA as well, we've got the sound engineering school. There are a lot of young people in and around our campus, which is why strategically we were located as a facility that would be useful to get the message out there and get the vaccinations rolled out.
Well, finally on that, some have said that the media haven't been educating people enough. There's still so many people with basic questions around vaccinations. Has the SABC done enough? I know there is now a partnership with COVID Comms. We're offering preferential rates for adverts around vaccines. And I include myself in this, but I'd like to know from an SABC perspective, do you believe the media, we have done enough?
Francis, we can never do enough in a situation like this. I mean, it's until everything has been stabilized, until everybody is protected, until everyone is safe, we can never say we've done enough. We can always do more. But we are very excited that with this particular venture, we are actually targeting specifically that group of the population that, one, are the largest in numbers in the country, and secondly,
But Ms. Ntuli, my question relates more to using what we have beyond a pop-up site, airtime.
Oh, absolutely. I mean, I think that we have partnered with a number of establishments to actually get messages out there. And remember, Francis, our role as the public broadcaster is not just to talk about the vaccine, is to actually educate the public about the entire COVID-19. We've been doing that, and we have been the first, actually, as the SABC, to publicize this pandemic, to keep the public informed, and constantly giving information that not only saves lives but keeps people informed about what to do to protect themselves. So I think that we can never have done enough. We must always look at opportunities to do more, which is why strategic partnerships are really key to help us do that. But we can never ever be blamed for not having done something to educate the public about the current state of affairs.
All right, thank you. The head of marketing and communications at the SABC, Gugu Ntuli.